Migraine. Many people think it's just a bad headache, but migraine is much more than that. It is a neurological condition that affects millions of people around the world. It doesn't only cause pain, but also nausea, sensitivity to light and sound, and sometimes even temporary vision or neurological changes. Migraine is a chronic condition marked by recurrent attacks. The pain is often moderate to severe, throbbing or pulsating, and usually felt on one side of the head. But migraine is not just pain. It involves changes in nerve activity, blood flow, and brain chemicals like serotonin. Migraine attacks often follow stages. The first stage is the prodrome, which happens hours or days before. You may notice mood changes, yawning, food cravings, or fatigue. The second stage is aura, which happens in some people. It may cause flashing lights, blind spots, or tingling in the face and hands. The third stage is the headache itself, with severe throbbing pain, nausea, and sensitivity to light or sound. Finally comes the postdrome, when the pain fades, but you feel drained or confused. The exact cause of migraine is still not fully understood, but it often runs in families. It is linked to changes in brainstem activity, the trigeminal nerve, and fluctuations in brain chemicals like serotonin. In simple terms, migraine is the result of an overexcitable brain reacting to certain triggers. Common triggers include stress, hormonal changes, irregular sleep, certain foods like chocolate, cheese, or alcohol, bright lights, loud sounds, strong smells, and even weather changes. There are different types of migraine. Migraine without aura, which is the most common. Migraine with aura, which includes visual or sensory symptoms. Chronic migraine, when attacks happen on 15 or more days each month. Menstrual migraine, linked to hormonal changes. And rare types like hemiplegic migraine, which can cause temporary weakness on one side of the body. There is no single test for migraine. Doctors diagnose it based on your history and symptoms, and sometimes use scans to rule out other conditions. Treatment has two main goals: to stop attacks when they happen and to reduce their frequency over time. For acute treatment, people may use pain relievers like ibuprofen or paracetamol, triptans, or two newer classes of medicine called Gepants and Ditans. Gepants work by blocking a substance in the brain called CGRP, which plays a big role in migraine attacks. Examples include ubrogepant and rimegepant. They can be used to treat an ongoing migraine, and in some cases to prevent attacks. Ditans, on the other hand, work on serotonin receptors in the brain to calm down overactive pathways. An example is lasmiditan. Unlike older triptan drugs, Ditans and Gepants do not constrict blood vessels, which makes them safer for people with heart problems. For prevention, doctors may also use beta blockers, anti-seizure drugs, antidepressants, CGRP monoclonal antibodies, or Botox injections in chronic cases. Lifestyle changes are also very important. Managing stress, keeping regular sleep, staying hydrated, exercising, limiting caffeine and alcohol, and tracking triggers in a diary can all help reduce attacks. Migraine can be invisible to others, but very disabling for the person who lives with it. If your headaches are frequent, disabling, or if your pattern suddenly changes, it's important to see a doctor. Seek help immediately if you have sudden vision loss, weakness, or difficulty speaking, as these could signal a medical emergency. Migraine is not just a headache. It is a complex neurological disorder that can affect every part of life. But with the right treatment, lifestyle adjustments, and awareness, many people find relief. If you or someone you know lives with migraine, don't ignore it. Seek help, track your triggers, and explore the treatments available today. And if you found this video helpful, make sure to subscribe to the channel and share it to raise awareness. Stay informed. Stay healthy.